go.
Edwards, retired city clerk, former city commissioner, City of Daytona Beach. The Truth with Gwen Azama-Edwards on Goliath Radio.
Stan, you've been sitting much too long, much too long. Welcome, 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 welcome to Truth, the radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is, you got it, power. And as always, we want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, we want you to go to the website at www.gwen-truth.com so you can access all of those all-important links that will get you to that all-important information that will make you got it, all powerful, all powerful. Let me do a couple of shout-outs and then we'll get right into our show. Shout out to all of the veterans. This is Veterans Appreciation Month, and we want our veterans to know how much we truly do appreciate them. And hopefully, our government will do the same, not in word, but also in deed, in terms of showing their appreciation to you. And hopefully, all of our citizens also will say to you, thank you, thank you. And to many who gave the ultimate service, who paid the ultimate price, to those in their families, we say to them as well, thank you, thank you, thank you. Because of you, the world is a safer place. Because of you, there are places in the world that are in a lot better shape than they were before you got there, before you gave the service, before you died. And for that, they should be, and we most certainly are, very grateful to you. So thank you, thank you, thank you to our veterans. My second shout out is, of course, to all of the mothers. Sunday is Mother's Day, so happy Mother's Day to all of you. Happy Mother's Day. We will remember those who are still with us and those who are past, like my mother. But mothers are awesome, awesome people. And to all of you, I say thank you for your awesomeness. Thank you for your giving, your sharing. Thank you for all that you do. And many times I know it's not well received, especially when you're trying to discipline your kids. But you know what? Take heart, because years later, they will remember and they will thank you. I can guarantee that to you. They will remember your words and they will thank you. So, thank you and shout out to all of our mothers. Happy Mother's Day. Now, our topic tonight has to do with continued concern and continued discussion on health care. And my guest, of course, is the director for the Florida Department of Health in Volusia County, Dr. Bonnie Sorensen. And you read in the paper recently that Volusia County had dropped in its rankings. And we're going to get into that and some of the reasons behind it, but we're also going to share some other information too with you as well. And we're going to, of course, have to stick with our hour. And it went off, you know, applause, applause, applause. He actually went off on time tonight because something else is coming up. But whatever the reason, I say thank you, Vic. Okay, Dr. Sorensen, now, in regards to the rankings, and how Volusia County has slipped somewhat in terms of those rankings. How are these rankings developed? And what is it that has happened or not happened that's caused Volusia County to actually slip in terms of the rankings? We know in looking at the newspaper article and some of the information that came out, apparently St. Johns County is ranked number 1 or somewhere in there, and Flagler County is ranked higher than we are. So what is this all about? How is it developed to do the rankings? What do they use? And why have we slipped?
Great questions, Gwen. And thanks for asking me to come in and speak about this. The county health rankings are really a national effort. The county health rankings are essentially a health snapshot of every county in the nation, all released at the very same time. Each spring for the last 5 years, the University of Wisconsin has been compiling these health snapshots of every county across the country and releasing them online. And you can go look at any county you want in the country by going to countyrankings.org, and all the states and all the counties are there. So the University of Wisconsin compiles the data. Obviously, in order to compile data on every county, they have to use data that's available in every county. So the data that's used is very common to everybody across the country, and it's also somewhat limited for that reason. We may have more refined data in our community, but we only have it for our community, and it's not available nationwide. So the data that's used is somewhat generic. The other interesting aspect of the rankings is that the word ranking comes from the fact that they rank the counties in every state from 1 to whatever number of counties they have. In Florida, we have 67 counties, and the counties, therefore, in Florida are ranked 1 to 67, 1 being the healthiest county, 67 being the unhealthiest county. And I think we also have to remember that Florida as a state is ranked amongst other states as well. We receive that in the newspaper periodically, and Florida doesn't rank too well, compared to other states. And then when Volusia County doesn't rank very well in Florida, that's sort of a double whammy.
Yes.
You're right. The health rankings, the Volusia County health rankings in 2010 was 35 out of 67. This year we are 43rd out of 67. Now, an additional aspect of the rankings is not only do they give us an overall health ranking, which is the 43rd, but they also give us rankings for the factors that influence health. And they've identified through research 4 factors that significantly influence our health. One of those factors is our own health behaviors, whether we smoke and drink too much, or whether we are physically active or eat healthy, or engage in risky sexual behavior. So health behaviors contribute to our health. Other factors contribute to our health, such as the clinical care, the amount of health care facilities that you have in your community. Socioeconomic factors influence our health, and the physical environment influences our health. And they actually weight these factors according to how much they do contribute to our health. Our assumption, I think, across the nation is that, well, healthcare is our major contributor to health. Well, au contraire, healthcare, the clinical services in our community, only contribute 20% to our health. And healthy behaviors contribute 30%. Lo and behold, socioeconomic conditions contribute 40% to our health, and the physical environment contributes 10% to our health. And not surprising, in Volusia County we have multiple high-level hospitals, including a level 2 trauma center. We have neonatal intensive care, pediatric intensive care, medical, surgical intensive care. We have multiple nursing schools in our community. We have a medical school in our community, along with a family practice residency program, a surgical residency program, as well as 3 hospital taxing districts that tax our community to pay for indigent care. So we have a fairly robust healthcare system in Volusia County. So we rank 17 out of 67 for clinical care. Last year we ranked 12, and we've dropped down to 17. So that's a little bit of the reason that our overall outcome has decreased. Our health
now let me ask you, is that because those areas now have all of the types of facilities that we have, and so they're keeping up, so there's...
Yes, that's probably, our healthcare system hasn't changed, but the healthcare systems in other counties, we can see in the newspaper that the trauma units are increasing, so that improves the score of some other counties. So health behaviors, though, interestingly, has improved. So the message is getting out about tobacco and about eating healthy and about being physically active. So in 2010, our health behaviors, we ranked 36 out of 67. This past year, in 2014, we ranked 28 out of 67. So there has been an improvement in our personal behavior. So folks are listening, folks are heeding good healthy advice, and that's improving.
Can I ask you a quick question?
Sure.
Because people may think, because we're a tourist area, that perhaps some of these people are being surveyed, but are they just surveying or looking at the people who actually live here?
Yes,
Right.
the data is pretty much from the residents, not from tourists. So our socioeconomic factors, we used to be 47 in 2010, we improved to 32, 36, and 38 for 3 years, but this past year, we were 43rd out of 67. And certainly the economy has impacted all the counties across our state, but certain counties are sort of adversely impacted more so than other counties, and we can talk a little bit more in detail about that. The physical environment used to be 11 last year, and it's 32 this year. And part of the reason is because they've changed the data. They've been changing the data in the physical environment. So we ranked higher last year because we had some boil water notices this past year, particularly in Daytona.
Right.
Our ranking went down in the physical environment. So those all add up to influence our overall outcomes. But the overall outcome ranking is pretty much dependent on premature deaths. By definition, all of us are supposed to live to be age 75. If anyone in our county, a resident, dies before age 75, that counts against us. But if anybody dies at age 99, that doesn't count in our favor. Right, so what's interesting about the premature deaths in Volusia County is we've been increasing the number of premature deaths every year for the last 5 years.
Oh, wow.
And yet nationally, the number of premature deaths nationally has been going down nationally. And that is really impacting our overall health outcome. Now, you ask why we're having premature deaths. I mean, we started digging a little bit into the data. We've looked at the data of the surrounding counties. And when you look at the educational ranking and you look at the income ranking, the health ranking is almost exactly the same. So for example, St. Johns County, educational ranking number 1, 82% of kids in St. Johns County graduate. Income ranking, their average income is in the 60,000 range, and they rank the healthiest county.
Wow.
If you look at Seminole, they rank 3rd for educational, 3rd for income, and 3rd for their county health ranking. Orange County, they rank 13 in education, 13 in income, and rank 12 overall. Volusia, we rank 34th in education. Only 62% of our folks graduate from high school. Our income was ranked 44, and hence our overall health ranking is 43.
Wow.
So it's really all about education, which begets good job opportunities, higher income, and folks who have higher income have more opportunities for better health. Not only access to health care, but they may live in a better neighborhood that is more enriched with parks and trails, with healthy food, grocery stores instead of just convenience stores. So better income begets better health, and it comes from education. That's really the bottom line, I think, on the county health rankings all over the country.
Of course, that you could ask the question, which comes first, the chicken or the egg, because there are people with higher income, with higher education who live in the county who aren't able to get the better paying jobs because the better paying jobs for the most part are not here.
Yeah, that's exactly right.
And
so
you can't draw them here because they look at the workforce, and if there is not that information and that workforce does not have that educational, not just attainment, but in the right areas as the employers want, then we won't draw them either. So we're kind of not caught in between, but somehow or other we've got to still get the better paying jobs, as they're trying to do with Embry-Riddle. And some of the jobs they're talking about with the Speedway, some of those will be higher paying jobs. But that's what we've got to draw, but we've also got to get our workforce there.
Exactly. Do we attract highly educated folks? Well, if we don't have high paying jobs, no. Even if folks locally become educated, then they're likely to leave where there are higher paying jobs. So yes, it's great that we have economic development and that we're encouraging growth, but we really need to focus on the high-paying jobs.
Absolutely.
And,
Absolutely.
tourist jobs are probably not the best in terms of income, health insurance, all the benefits, et cetera. So you're exactly right. And why do we stay at a mediocre or mediocre minus level of health status? It's because of the folks who live in our area.
Well, that's a wake-up call.
Turn that around, exactly. It's all about education, income, and high-paying jobs.
Wow.
It's kind of it's scary.
And as we talk about that, though, what has happened then between 2010 and these current rankings? Have a lot of the persons who had the higher education, or a lot of the maybe even better paying jobs, left the area?
I think that's somewhat true. I mean, obviously, we have pockets in our county who are ridden in poverty and lack of educational opportunity, lack of job opportunities, and that cycles in those pockets of area. Those areas need to be addressed. We need to support those kids in those areas with educational opportunities, mentoring opportunities, job opportunities to try to improve the quality of life in those particular areas. I mean, we don't want necessarily just to attract, highly educated folks from outside to come in and take highly educated jobs.
Right.
We need to grow our own.
Absolutely.
Because that's who we want in our community. That will increase the quality of life overall for everybody. We need to raise the boat in Volusia County. Yes, we do have some, well-endowed areas with highly educated people and highly educated jobs, and those communities tend to have better parks and trails and better grocery stores, better businesses and job opportunities. But I think the focus needs to be mostly on how do we upgrade the areas, the pockets of our community that are deprived and depraved, rather than say, well, we just need to recruit some folks from St. Johns County to come live in Daytona. That'll fix our problem. It's like, well, no. I mean, it's interesting that St. Johns County has been the healthiest county for the last 5 years. Seminole has been around 3 or 4. St. Johns County is about 90% white. 82% graduate from high school. They have more college-educated folks in St. Johns County. Over 90% of folks in St. Johns County have health insurance. It's probably related to the jobs that they have in St. Johns County. So they have everything going for them. The least healthy counties in Florida are generally the rural counties in kind of mid-Florida. The lowest health is in Bradford and Union counties, where Stark Prison is in the middle of Bradford County. The prison health sort of counts against that county. The lack of jobs, they basically have prison jobs in those counties, and it's going to be difficult for them to improve the health of their community.
It really speaks to the fact that you said that we've got to raise the boat. We've really got to do more to bring in the better paying jobs. We're trying to do more to bring in some, but we've got to do much more.
We do have to do much more, and certainly, Daytona State has been a very good partner to the business community over the years, trying to identify what are the skills that are needed in business, even if it's not a college education, if it's a vocational, technical knowledge. They certainly have tried to align with what is needed in the community and try to educate folks up that will be ready to take those better paying jobs. I mean, the chicken and egg. You need better educated folks to attract higher paying industries, and then the higher paying industries will attract better education. I think it's all aligned. It's just amazing when we compare ourselves to other counties and nationwide, how much more improvement is possible, how many more opportunities are out there.
Yes, and how they seem to continually get those things, attract those things, go after those things. And
exactly.
We've got to do it here.
Yes, Seminole County is a great case in point. They marketed their county health rankings, basically saying, hey, we've got a high quality, we've got highly educated, they used the rankings to market better paying jobs and more businesses into their community. It's really a quality of life issue, where Volusia County, they certainly aren't out there talking about our county health rankings.
No, we're talking about our beach, and
yes.
we're talking about
Those are very important assets.
Yeah, it is, but,
right.
you get what you market for.
Exactly.
Okay, now, let's talk about some of the other issues that have truly impacted healthcare in our county, and as a result has impacted your agency, the Florida Department of Health. The Medicaid expansion, a non-expansion, I will say, in terms of the dollars that were available, but also in terms of this rollout that you're saying that the state has gotten into. How's that impacting you, and what's the impact on the citizens?
Mm-hmm. The Medicaid has been one of the biggest budget items for the state for many years, and around 10 years ago, under the leadership of Jeb Bush, they asked the Medicaid offices federally if we could do Medicaid reform, quote unquote, and at that time, 5 counties were chosen to pilot Medicaid reform, and that's Duval County, Clay, and Baker County, Nassau County up north, and Broward County down south. And those 5 counties have been sort of in this pilot phase for almost 10 years. And what the pilot was moving all Medicaid people into a managed care entity, an HMO. From a fiscal perspective, the Medicaid office pays the HMOs only 95% of what it usually costs them to take care of a Medicaid patient. So for Medicaid, it was a good deal. If we can get HMOs to take care of all these folks for a fixed price, that's 95% of what we usually pay, then we as the Medicaid agency save 5%. And when you're saving 5% of $30-some billion, that's a lot of dollars.
Right.
So after that pilot study of many years, they requested from the feds to expand Medicaid reform statewide. And a year or so ago, they were given permission to expand it statewide. And this year, it's beginning to roll out. It's beginning to roll out statewide. Our area, Northeast Florida, is first. It started to roll out May 1st in our area. The last area is Central Florida and kind of southwestern. It'll roll out August. But every month, another region is beginning the process of moving all their Medicaid patients, women and children, and elderly who are sitting in nursing homes, are all being moved into managed care entities. So May 1st, before May 1st, around a month or two before May 1st, every Medicaid patient in Volusia County got a letter explaining this complex process, but they were given the choice of the 4 HMOs that are in our area, given a choice of picking any one of those 4 HMOs to begin their care May 1st. If they did not choose in that 30-day window, then they were auto-assigned by the Medicaid agency. So May 1st, everybody in Volusia County, every Medicaid patient is in a Medicaid HMO. They then have 90 days to figure out whether they want to stay in that HMO or change. So in this 90-day period, there is quite a bit of scrambling going on, patients figuring out that, well, gee, I'm in this HMO, but my doctor is not in this HMO, he's in another HMO. Or the provider I want to go to for this is not in my HMO, so I need to switch HMOs. Well, you have to call the Medicaid folks or go online and formally change your HMO assignment. After 90 days, there'll be no more changing. You'll be actually stuck in that HMO for the rest of the year. For a year.
That's like about around August 1st, somewhere in there.
Right. Well, ours is May 1st, so everybody was assigned as of May 1st, so for 90 days, right. During the summer, you have the option to change, and then you'll be stuck in there for a year until open enrollment opens, and you can then switch HMOs. These HMOs have contracts for 5 years, so the HMOs are not going away. And once you find an HMO that you're comfortable in, that's fine. This is surprising to me, but I guess not surprising. The patients may be aware of this, but the healthcare system is hardly aware that this is going on. So May 1st, the doctors are waking up Oh, well, I need to contract with an HMO? So many doctors who see Medicaid patients may have used this as sort of an opportunity to say, well, I'm not going to contract with HMOs. I didn't mind seeing Medicaid patients, but I'm not going to go into business with an HMO, so I'm just not going to see Medicaid patients any longer. Because unless you're contracted with the HMOs, you're no longer a provider, and they will be sent somewhere else. So that's a problem. The physicians who want to continue providing service with HMOs, they're just starting to wake up and realize that, well, gee, I need to sign up with this HMO or that HMO. Every HMO has their own process. Every HMO has their own credentialing process, which often takes 60 or 90 days.
Wow.
So we're kind of behind the curve. There's going to be quite a bit of confusion in our community by the patients looking for their providers, and the providers either not being contracted with their HMO or not having started to get contracted. So there's going to be a scramble this summer, I think, before things settle down.
And if in the meantime, while they're still waiting, looking, whatever, will they have access to health care, or do they go to the emergency room, or what are they?
Well, Medicaid says that the HMOs are required to pay anyone who sees patients, who's been seeing patients for the next 60 days.
Oh, okay.
Well, okay, that's what Medicaid says. We're talking to the HMOs because we have patients that May 1st are assigned to another provider. We're talking to the HMOs, and the HMO will go, well, sorry, we're not going to pay you to continue the care. As Medicaid said, that patient needs to go elsewhere. So there's quite a bit of confusion going on, and we're certainly ready and willing to continue care of patients. But the HMOs have not come to the health department and asked us to continue care.
Oh.
So we're not contracted with any of the HMOs. So we're going to be basically squeezed out of the any kind of primary care, maternity, even some of our family planning seems to be going elsewhere.
Yes, because I'd ask you about the prenatal care that you had been doing, and that will discontinue.
Yes, as of July 1st, we're no longer going to be providing prenatal care at the health department. We've been providing prenatal care for 20 years, and it's been a fairly comfortable arrangement in our community. We actually see most of the high-risk patients, whereas the private sector sees most of the low-risk. We see a bulk of the Medicaid patients where they see the insured patients. So it's been a fairly comfortable relationship. We provide all the records of patients to the obstetricians who end up delivering these patients. But going forward, they're going to be responsible for taking care of these patients. And we've been working closely with Halifax and Florida Hospital on the east side. Both Florida Hospital and Halifax have positioned themselves to be able to provide that prenatal care as of July 1st. They're even in place now. On the west side, we're working with the Florida Hospital and the Federally Qualified Health Center, and both of them have positioned themselves to take the patients who are on the west side of the county. So there should be a fairly smooth transition, but it's in the middle of this Medicaid reform, which has caused quite a bit of chaos and confusion for the Medicaid patients. So we've got multiple things going on, and all of us are working hard to try to connect folks to their next provider and make sure that the care is not dropped or insufficient.
One of the things that they found, I'm a member of the Healthy Families Board, and one of the things that they found was that a lot of individuals who give birth are going to St. Johns County or Seminole County or Orange County, but mostly Seminole and St. John's.
Right, mostly Seminole County. We have a lot of folks in Volusia County who choose to go over the river to either Altamont Hospital or to Sanford Central Regional. Those are Florida hospitals. And there's a number of reasons for that. It's mostly people who are on the west side of the county. We hear a variety of reasons. There's a number of obstetricians in Deltona area and South DeLand who don't deliver at the DeLand Hospital. They only deliver across the
yeah,
river.
yeah, I've heard
So
that.
if the patients, hook up with those obstetricians, they have no choice but to drive over the river to deliver. The Florida hospital in DeLand has had some struggles with coverage, some struggles with anesthesiology. The Florida hospitals are generally nicer in Seminole than in DeLand, but the DeLand hospital is trying to spiff up their image, spiff up their facility, also increase the services that are provided, try to provide tubal ligations and elective surgeries for women on the west side. So I think they're making a turnaround and are going to be trying to attract those patients more strongly.
One of the things that we talked briefly about too before we started the show had to do with legislation that has been recently passed. There's a lot that's continually passed. There's a joke they say that hold on to your pocketbooks and your whatever when the legislature's in session, because it's like everything's up for grabs. But there was legislation that was passed that directly impacts healthcare and directly impacts what you do. And one in particular had to do with what they call Charlotte's Web. That as it relates to marijuana. Educate us.
Yes, the Charlotte's Web version of marijuana is a special grown version of marijuana. It's not the usual and customary marijuana that gives you a high. It's a different form of marijuana that has been shown in some anecdotal cases to control seizures in children who had intractable seizures in the country. So those folks who have children who have continual seizures showed up in the legislature and begged the legislators to legalize in Florida this Charlotte's Web marijuana for the sake of their children. And the legislators heard and listened and passed a bill that legalizes this Charlotte's Web marijuana. In the process of the sausage being made, the use of that Charlotte's Web increased in the bill that was passed by the legislators to include other neurologic conditions such as intractable spasms, certain cancers. So the use of it, which initially started to be focused on the children with devastating seizures, is now more broad. This type of marijuana allegedly provides no high, and therefore the thinking of the legislators was it really wouldn't be demanded by the public. But this version of marijuana will be available by January 1st to patients who qualify for the use of that. It's not a drug, it's not a FDA-approved drug, so it's not going to be coming from your pharmacy. There's going to have to be special concessions designed to provide that to certain patients.
And you were saying that it's the Department of Health that will be writing the rules for it.
Yes,
and there will be, about 20 locations, growers that
the legislation directed the Department of Health to oversee this process. So there's a special office of compassionate use that's been built into the Department of Health, and it's called compassionate use because it's not an approved drug. So also in the legislation, it states that up to 30 nurseries will be designated and allowed to grow this particular type of marijuana. Now that'll probably be overseen by the Department of Agriculture in terms of the rules related to growing the marijuana. In terms of dispensing, it's not really dispensing because again it's not a drug, it's almost like administration of this drug. They initially conceptualized there would be 5 administration areas, one in 5, they divided the state into 5 regions, said there'll be one place that will administer this non-drug across the state. And then there's a special kind of process for patients. It's like patients are going to need to be registered as being qualified by some criteria. The rules have yet to be written. Some physicians will be have special training. They'll have to go through special training in order to be a writer of this non-drug, and then they'll have to register patients that they've written this non-drug prescription for, and then the patient will have to go to this special place that they're going to give this non-drug that's been grown by these nurseries. So it's quite a it's not a process that's going to follow the usual and customary, process of, oh, you need a drug, you go to the pharmacy and you get a prescription and, just run down to the pharmacy and get it, because this is not an FDA-approved material. So it's going to have its own process for the physicians prescribing it, the patients being issued a card or some sort of registration that will allow them to get it, and then they'll have to transport to find it.
And all of that rulemaking, I guess, will start as soon because
it's already started.
Oh, okay.
And the governor has not yet signed this bill, so it's not in law until the governor signs it. But obviously, because of the complexity of it and the newness of it, the department is already trying to figure out the process along with the Department of Agriculture, because the law demands that it be available by January 1st. So there's an amount of time to work out all the logistics and all the growing and all the registering before patients can finally get it January 1st. Assuming that the law is passed and signed by it's passed, but it's not signed by the governor yet.
Right. And my statement, this is not your statement, but my statement is that it looks like if then I believe it's amendment, what is it, 1 or 2?
I don't know which number it is, but the marijuana amendment.
The marijuana amendment, right. That if that passes, then there will already be a process that's pretty much set up in place for the initiation of that and that whole thing going forward.
Right, and that was some of the interesting discussion during legislation, despite the fact that legislators generally oppose the amendment. That was part of the discussion during legislation. It's like, well, gee, you're just setting it up. You're setting yourself up for success rather than failure. So you're right. As they work out the logistics, it may be that if the marijuana amendment passes, then it could be overlaid, over this process or logistical process.
And one final question in regards to that, though, is that isn't it still federally against the law to use drugs?
Exactly, which makes it all the more difficult. We've looked at California and Colorado and the state of Washington. All three of those have approved medical marijuana. Colorado has even gone further and approved recreational marijuana. But it's a challenge to figure out the process because it's illegal federally. So the folks who sell the marijuana, either at the nursery or at the dispensaries, have a lot of money that they need to bank. But the banks are unwilling to take that money. So they actually have a sniffing process to sniff the money to see if it has any odor of marijuana on it, and the sellers, the dispensers, have to kind of decontaminate the money. They're into trying to figure out how to make this money not smell like marijuana so that the bank will take it, because the banks don't want to be caught with it because it's illegal.
Then it's
marijuana
like
federally, right? So
laundering,
they're thinking, nationally, there's this kind of dread by the banks that the feds will, for some reason, decide they're going to clamp down on laundering of illegal money, and the banks will be caught in the middle of it. So that has yet to be addressed in Florida. The Charlotte's Web version of marijuana is a liquid. It's actually an extract of the marijuana, so we probably are not going to have that issue with the Charlotte's Web, because it's not, won't look like marijuana, it won't smell like marijuana. It'll be actually a liquid that's made to administer to children or people with neurology type of problems like Parkinson's disease or something. So initially, with the Charlotte's Web, we'll probably not have the issue. But, as you mentioned, if the medical marijuana amendment passes, and that then gets into the system, we will have the same problem in Florida, I guess, of nobody wanting to touch the money.
Right, absolutely. So the growers will grow it, and then they will transfer it to some place that will actually do the part of liquefying it and making it available.
I guess so. That's not exactly clear, because nurseries aren't usually into the chemistry.
No, they're not.
And then who would be deemed qualified to do that? Would it be the area, I mean, would it be some entity that would be distributing the liquid? Is that the, would it be one of those 5 companies that somehow designated as the distributor of this stuff? I don't know. It's not
It
well
really,
worked out yet.
yes, it
We have
sounds
until
like.
next year to figure it out.
Thank God for that, because from what it sounds like, you guys are gonna need that much time and more, but you have to, as you say, have it ready for January
And this is
1st.
gonna be a lucrative business, so
Yes.
there's gonna be bidding out, there's gonna be bid protest, along the way, so you have to kind of start it now to get through all the process by January 1st.
And I can just see underground types of places developing that will say they've got the same thing, you can get it cheaper, blah, blah, this, that, and the other. Ingenuity. America has a lot of brain power that goes into ingenuity, especially when it comes to criminal activity. But I'll leave that there. You listen to Truth with Gwen Azama-Edwards. My guest is Dr. Bonnie Sorensen, and she's with the Florida Department of Health. And we're discussing several issues in regards to health care, the rankings we've discussed for Volusia County, which have slipped, and the portion of marijuana that will be liquefied, that's a part of the Charlotte's Web legislation, which the state legislators recently passed. But for those who are not, and this is WLE BIG Big 1380 AM on your radio dial in Ormond Beach, Florida, and this is Truth with Gwen Azama-Edwards. For those who are not familiar with, since your services will change somewhat because of your divestiture pretty much of some of those things that you were doing, for those who will now be covered under an HMO as far as Medicaid is concerned. But for those who do not know the services that are available through the Department of Health in Volusia County, could you share what is available now, and if it's something that will be discontinued, just mention that too along the way.
Sure. Yeah, the prenatal care is the major program that we are divesting from as of July 1st, so we'll no longer provide prenatal maternity care at the health department. But we retain all the remainder of our services. We have 4 sites across the county, 1 in each of the quadrants of our county. New Smyrna, Daytona, DeLand, and Deltona. We also have some services up in Pearson in collaboration with our federally qualified health center. The services are primarily immunizations, family planning services, STD services, sexually transmitted diseases, or something to do with however you think STD means, and kind of TB, HIV services we provide all over the county, and we will continue to provide those in all 4 of our sites. And we will try to be available. The fact that we no longer will see Medicaid patients, the number of services may diminish, but that gives us an opportunity to preserve our dollars for folks who don't have insurance. We kind of pride ourselves in being available to folks who don't have someplace to go. So that we spend a lot of money on those services. We have lots of staff, but it's oftentimes because of the huge volumes of Medicaid patients we get. The fact that we get out of the prenatal service in Medicaid, or Medicaid patients are directed to go elsewhere for their family planning or immunizations, is fine with us. That just preserves our dollars to spend on folks who don't have anywhere to go. So that's what we'll kind of shrink to provide services when folks don't have insurance, don't have Medicaid.
Now, I want to make sure that people understand this, because there are still a lot of people out there who have no medical insurance and no health care coverage. So Do they have to have employment? Do they have to meet a certain income guideline? Are there any other qualifications to be able to receive services through Volusia County Health
Oh,
Department?
there's always caveats to that, right? I mean, the free clinics in our community, the Jesus Clinic and the Good Samaritan on the west side, and the other one here in Daytona at the mosque, they are required to, or they choose and are somewhat required to serve folks who are employed, but who are underinsured or uninsured. We don't have that caveat. We actually serve folks who are employed or not employed. But there are qualifications. We're trying to serve the poor, not folks that have money to buy insurance and just choose not to buy insurance. We're taking care of folks who don't have the dollars to pay for insurance. So, for WIC example, WIC is the Women and Infant and Children program that provides nutritional education and nutritional supplements that nowadays are on an EBT card, an electronic card, rather than a paper check or a paper voucher. But we serve women and their children who are under the 185th percentile of poverty. Now, the 100% poverty level for a family of four is probably, what, 20-some thousand. A family of four would be close to 40,000. So we serve in WIC folks who qualify for the WIC supplementation. Family planning is somewhat similar. We can serve for free those folks who are under the 185th percentile poverty. If you're above the 185th percentile, then we serve you on a sliding fee schedule. For vaccines, for immunizations, especially for children, if you are Medicaid or Medicaid eligible or uninsured, the vaccines are free. If you have insurance, we're going to try and bill your insurance. If we can't cut a deal with your insurance company, then we're going to refer you back to your HMO or your insurance company to receive services. The HIV type of services, they have their own qualifications, different for medication, different for housing, and we have eligibility counselors at the health department that walk through all that with patients who have HIV, their case managers, to let them know what they're eligible for and can connect them to the services that they need.
So if someone walks in, finds themselves in the wrong place, the person, your staff person, will actually still sit down, talk with them, and share with them what they're eligible for.
Oh, sure.
And then send them elsewhere. So that's good. That's good. Now, in our closing moments, and we've got maybe about 8 minutes, what is it that, because I know you're great at what you do. I'm not just saying it. Everyone recognizes the fact that you are great at what you do. In fact, to the point where you actually go to other places and help them when they need or in need of an interim director. And you've been to other states. You know a lot of what's going on in the healthcare field, and you stay on top of that. Even your assistant person ended up, where is she now?
Don't remind me. Right, Dr. Celeste Phillips, that recruited to sort of be my succession plan, suddenly was recruited to Tallahassee. So she's responsible for a lot.
Well, you have good staff. That, you're good and you have good staff. But as we look at healthcare overall, do you, in your readings and your research and everything else, do you see things getting better, generally speaking, in terms of healthcare for Americans? Or we can limit it to just our county or the state? Or do you feel that as we take one step forward, we seem to be taking 2 steps back?
That's a great question, Gwen. Certainly the Affordable Care Act is here. It's been going on since 2010. And the basis of the Affordable Care Act is everybody should purchase health insurance. And it's mandated, otherwise you pay a penalty. Of course, there's been a lot of controversy about that. The problems, that we're seeing is that the insurance, although you may have health insurance, there's co-pays and there's deductibles. And folks who've been receiving care for free at the emergency room or at free clinics or even at the health department, who are now in a position to buy insurance, they're, facing the reality that, well, gee, it's no longer free. So that group of people are, kind of discouraged that will, and we're hearing that somewhat. It's like, well, why should I buy insurance when I can just come here for free? And that's sort of a paradigm shift for folks who have been receiving free care from a variety of sources across the country. So that's a challenge for that group of folks. Folks who've always had health insurance are very knowledgeable about co-pays and deductibles, and they just sort of take it in stride, but they're more likely to have a better income and be able to afford the co-pays and the deductibles. Same with the Medicare folks. They can join an HMO and not have any co-pays, or else they can do straight Medicare and pay the co-pays and pay the deductibles. So the whole system of insurance is a whole new mind shift. Some folks would argue that maybe insurance is not the best way, the ultimate way. Maybe private insurance is not the best way to go. That actually private insurance companies are in they're in the business to make money. If you look at the tallest skyscrapers in many of our largest cities, they're all insurance skyscrapers. So that's where the money is. Some folks have argued that, well, what if we had a Medicare type system, a government run system, that took care of all the folks between Medicaid and Medicare, that the young and the old, we just expanded Medicare down and expand Medicaid up and close the gap of the working folks in the middle and cover everybody and have sort of bulk purchasing, standard of care. Some folks are arguing that system might work better in the future. So it's going to be very interesting watching. Are we going to continue this insurance-based healthcare system requiring everybody to buy insurance? Because that's the only way insurance works. Insurance wants to take care of well people, not sick people. If you didn't mandate everyone to get in, then all the sick people would have insurance and all the well people would be flying without insurance. Is that the best system for our country going forward? Or is some other system going to be better? The countries we look at around the world, the German and the Scandinavian, the Danish, the Cuban, those are all somewhat socialized in the sense that everybody pays in and everybody gets benefits. So Canada, the healthcare is basically free to go get the health care, but everybody's paying a tax to pay for the health care for everyone. That's a system that's been looked at. It's not based on insurance. It's the government collecting tax to pay for whatever health care it wants to provide, and everybody gets universal access to that health care. So right now we don't have a choice. We have an insurance-based system, but stay tuned.
Amen, amen, amen. We know about the rankings, and we've got maybe about 2 minutes left here, but we know about the rankings. We know we're slipping. What is it that we as individuals can and should do, and what is it that government needs to do really to step up? We've talked about the need for better paying jobs and the like, but what's I know that there's no quick answer, no quick remedy, but what is it we're not doing?
Well, we've talked about it a bit, as you mentioned. There's a lot that folks are doing. The hospitals have all been required by the Affordable Care Act to do community health assessments and community health improvement plans. So each one of our 5 not-for-profit hospitals has a community health improvement plan that they're focused on in their respective communities. The health department has kind of collected all these folks and all these plans, and we have a Health Evolution group that's looking at, well, what are the priorities? How can we improve health in our community? And that group has decided, really, in concert with the hospitals, that the 2 largest issues, the 2 priority issues we need to work on is access to health and obesity. So we have subgroups working on both access to health and obesity, and the groups are creating strategies to help improve access through the use of the 211, better education about what's out there, and better address obesity, partnering with the schools and communities to do community gardenings, partnering with cities to improve sidewalks and playgrounds, that sort of thing. In addition, the health department, we're starting the process of creating a series of health evolution reports. And our first report actually looked at all these data in a more granular way. We actually divided our county into quadrants, and we're looking specifically at what are the needs, the healthcare needs and the problems in each of those quadrants, rather than just on an average countywide. Because the quadrants of our community are very individual. So we're hoping that as we translate much of our countywide data into quadrant or even zip code specific data, it will better define the issues that are there and therefore help us understand and create strategies to try to address those.
And I'm sure one of the things that will be on the top of the minds of our listeners is that as we strategize that, and I'm sure you would say the same, as we come up with our plans and we strategize, we need to take the next step and take action. Because we seem to do a lot of planning and strategizing, but we don't seem to take that very next step, which is to actually put something into place that will actually help. So I do appreciate your frankness. I do appreciate your coming on and sharing this great information. You really educated me, and I'm sure you educated our listeners in terms of some of those things that we really need to look at and pay attention to when it comes to healthcare. So I do appreciate all that you have shared. Okay, it is that time for us to go off the air. There is a game that is coming on, so let me just say that you've been listening to Truth with Gwen Azama-Edwards. My guest, of course, is Dr. Bonnie Sorensen of the Florida Department of Health. And this will be on YouTube for you to listen to. Just go to the website at www.gwen-truth.com. Until next time, be informed, be empowered, and stand tall for that which is right and truthful. Again, Truth with Gwen Azama-Edwards, and like Dr. Sorensen, like myself, we're still standing, and we hope you are too. You be blessed and have a great week. And again, happy Mother's Day to all of the mothers.
With your host, Gwen Azama-Edwards, exclusively every Thursday night.